Hi everyone. In today's class, we are going to discuss one important topic which is related to respiratory equipment, that is spirometer. Okay, so spirometer is a basic equipment which is mainly used to measure lung volume and lung capacity. So you know what is the importance of lung volume and lung capacity assessment, right? So why we have to measure lung volume and lung capacity from this measurement, what kind of inference we can get, everything you might know. So that is the reason we have some kind of instrument or a device to measure these lung volume and lung capacity. One such basic device is called spirometer. So, and also the output which you are getting from this spirometer is called spirogram, as like ECG, EGMG, the graph which you are getting out of that experiment or instrument, they used to call gram, right? So here also the word end with gram, which is nothing but is the record which you are getting from the spirometer. So it's called a spirogram. So it's a very basic and traditional method which again it's used to measure lung volume and lung capacity. So the measurement of test performed by this pyrometer is especially in two ways. One is single breath test and second one is multiple breath test. So in single breath test, the people will have a normal inspiration or inspiration, or in case of expiration, that is the expelled volume, they can measure the expelled volume in minute. Multiple breath test means they have normal inspiration, expiration, or maximum effect by putting maximum, if they can have deep inhalation, exhalation. So this kind of different type of multiple breath tests they can take in order to access what is the lung volume and capacity of particular person. So let's see what is the actual working function of this pyrometer. So if you see this video, you easily get to know. Later you can witness this particular video. So now I'm just to know, I'm going to here explain what is working function of this spirometer. So see this diagram of spirometer setup. So initially we have in this setup that is trough. Okay, one trough is there. This is called trough. Inside the trough they have filled with water. Okay, so and this over this top we have a very transparent lid. Okay, this is what lid. So very transparent lid we have placed over the trough. Okay, in the trough we have filled with water. So trough has to be flowed over the water. So in order to make it to be in condition called floating, we have added some weight. Okay, that is counterweight. So this counterweight which makes the transparent lid to be float on the water. So there should be some pressure balance, right? So in order to maintain that counterbalance between water and lid, we have added some weight that is called counterweight, which is added at the other end of the lid. Okay. So and then if you see the tip of the lid, it's been connected with some kind of pen or pencil, because this is going to be draw the waveform pattern. So at the tip of the lid we have connected with pen or paper, and this we have made this structure in such a way to have direct contact with graph. Okay, so this setup is called rotating drum. Over the rotating drum we have a graph sheet. Okay, so this what it actually does in the sense, these rotating drum will rotate at a rate of some speed. Okay, and so that the graph sheet also move at a same speed. So based on the movement which is induced by the patient ventilation, the lid, according to the pressure difference, the lid will move up and down. Since the pen or pencil or needle which is being attached to the lid, it also move, or it will also move according to the movement given by the pressure by means of ventilation. So the pen will also move up and down. So as a result, it will draw wave-like pattern over the graph sheet. So that graph is called chemograph, which is the graph of a spirometer. Okay. So by means of this waveform pattern, we come to know what is a normal inspiration, what is normal exhalation. So during inspiration, the lid will go up, because when the person is doing pressure difference, inhalation there will be some pressure difference, so the movement will happen. Again the expiration there will be some pressure difference will happen, again the curve will goes down. So this pattern will clearly reveals the mechanism of a person breathing. So from this they come to know what is the tidal volume. Instead, whereas if they are doing some deep ventilation, that is deep exhalation inhalation, they come to know inspirated as a volume, expirated as a volume. From this value we can easily calculate it what is the capacity, vital capacity or total lung capacity. So this how we will made a calculation with the help of this setup, that is what spirometer setup. Okay, so if you see the other end, you have a mask, that is a face mask. They will just keep it on the they will place it over the face of the patient. So from this through this face mark the person will start to expire. Okay, so that means they will blow out heavily. Okay, so once they will blow out the air will go inside this tube, through this tube to the water. Okay, so because of the heavy blow the pressure difference will there will be creation of some pressure difference which will lift the lid towards the upward. So what happened then, the pen which is connected to the lid also will move towards up. So we have the pattern of curve upward direction. So similarly after escalation the people again they do inhalation. So again there will be some pressure drop, since all the gases in through the other wall is going to the patient. Okay, so there is something called canister here which is being filled with some soda lime. Okay, so you can see diagram here, that is the canister. The reason of having implement of this canister in this setup is that there are some cases we have to do multiple breath test, or in some cases they can go with single breath test. The reason is that when they are doing so many escalation and inflation, there are more chances for CO2 to get accumulated over there. Okay, so because there are some reason to have a 5 or 6 breath test, or even more multiple breath tests, since everything is like a closed setup, there is no gap or some space for the CO2 or other gas to leak or something. Because everything should be sealed at one closed thing, so that only we can easily calculate what is the volume and lung and so on. So what is happening? Once or thrice we are doing this process during this experiment, the CO2 will start to accumulate. So the same person when they do inhaling during the test, the more CO2, the excess of CO2 will get into the body and will lead to some other side effects. Okay, so in order to avoid that, they have included the canister with the soda lime. That the property of the soda lime is which will absorb the CO2, excess CO2. Okay, so when the gas which is returning back to the patient through the wall A, so in between the wall B, in between the wall B they have placed a canister. So the excess CO2 when it's traveling through this wall B all the way to the patient side. So when it pass through this canister, the excess of CO2 will get absorbed in the canister itself. Only the pure gas, that is contain only CO2, will goes into the patient during inhalation process. So the people will not feel some kind of suffocations. So they have a very normal testing process and procedure. So this is the reason they have included canister here. Okay, so this is a very simple traditional method of spirometer. So in this way they can measure the lung volumes and lung pressure. Thank you.